One night I was working for the trauma service in South Africa, and I just finished putting in a surgical chest tube for someone that was stabbed in the chest. So I was cleaning up my procedure tray, and then I was assigned to go see and manage someone who had a big laceration across his forearm after he was attacked with a knife. So I went to go grab a new suture tray, and one of the senior nurses physically blocked me and asked me, "What's wrong with that tray?" pointing to the one that I just used. And I thought that she was just joking, so I kind of chuckled and maneuvered to walk around her. But then she physically moved again to block me, and that's when I knew that she was dead serious. And she told me that if I used a new suture tray on every patient that I saw, that they would eventually run out of equipment for the night. And she gave me iodine and alcohol, told me to soak the equipment and wipe it down and to use it on that patient. And I thought that was crazy because HIV prevalence in South Africa at that time was around 15 to 20%. So I experienced a strong internal ethical dilemma. Do I suture this patient up and potentially expose him to a transmissible disease? Or do I really fight for using a new suture tray, but then potentially use up all the equipment and not have the equipment available if someone else comes in and needs it for a life-saving procedure? And this was probably one of the first times that I ever experienced firsthand limited healthcare resources and how it directly affects patient care. And obviously, healthcare resources in Canada and the USA are much better than that of South Africa. But in our broken healthcare systems, we still deal with similar situations in the form of limited personnel, like doctors and nurses, leading to long ER wait times, limited OR time for surgeons, leading to long surgical wait times, and limited transplantable organs, which can lead to ethical decisions on who is most deserving to live. And healthcare workers deal with these tough decisions every single day, which can lead to moral injury because we're not able to provide ideal care. And this is one of the contributing factors for burnout.